Good evening, and thank you, Dr. Komal, for that nice introduction. Basically, the lead program is where we learn together. I would say it is not just that the experts talk between them, but we, each one of us, learn from this experience and take home a lot of information. Now, I think today we are discussing in the next 1 hour a very important topic, right? Heart failure. Last decade, we used to talk about MIs, we used to talk about strokes, we used to talk about vascular events. Today, we are in heart failure. We realize that's a huge, huge problem. In fact, we are fortunate that last decade has shown enormous progress in drug therapy, right? To an extent where devices are taking a back seat. Okay, we have the 4 pillars, we have the ARNI, we have the SGLT inhibitors, the MRA, the beta blockers, and they together has produced an enormous change in the entire scenario of heart failure outcome. But, here is the but, and that is when we did the Trivandrum heart failure registry, 1,200 patients 5 years back, and today this data is available published in almost every leading journal. What we have learned is a couple of things. Number one, when we analyze the 5-year mortality, it is still 50%, right? Despite all these new drugs, it's still bad. But even worse, what we learned is this. In Kerala, we claim that we are all, Dr. Satish, my good friend is here, we say that we are all practice evidence-based medicine. Kerala is on the top of a health sector, right? Our infant mortality rate is what? 4.3. But then we found that only 24% of our patients at discharge go home on GDMT, guideline-directed medical therapy. 24%. 76% don't, right? And there's a hitch there. And what was the GDMT at that point of time when we started the trial, the registry? It was not this fancy 4, right? It was just an ACE inhibitor, a beta blocker, and an MRA, right? So even these 3 basic drugs, we are not giving it to majority of patients at discharge. And we also found that the hazard ratio of beta blocker at discharge determining 5-year mortality was 0.45, meaning that there's more than 50% reduction of 5-year mortality if your resident had written a beta blocker in the discharge prescription. So it's very important that we learn not just the basics, but what is new. And in that background, we just had the ESC Heart Failure Congress in Lisbon just last week. And today you have experts who will be presenting to you the data that has come out of it, the collated data, the filtered data, so that you can just learn straight away, number one. And the second part of the lecture is how best to choose an ARNI. We have huge array of ARNI brands today available in the market, right? From umpteen number of companies. Are they all same? Sometimes we find that our ARNI is not working. Is it because that we have not chosen rightly? The second topic would be presented by Dr. Pramod. First topic obviously would be presented by Dr. Subhash Chandra. So with that, I invite Dr. Subhash Chandra to deliver his talk on what we have taken home from the ESC Congress, Heart Failure Congress 2024 from Lisbon. Dr. Subhash Chandra.